It's not even going to matter if you have fungal acne or closed comedones. Hey everyone, welcome back to my channel. It's Unique, and I know you have been frustrated still trying to figure out if you have fungal acne or closed comedones. Since I posted my last video about how to figure out if you have fungal acne or closed comedones, this one right here, I have received some messages asking if it's possible to have both, or that you were still confused and didn't know what to do or what was the next right thing. So if you are still not sure what you are dealing with, this is going to be the video for you, because it's not even going to matter if you have fungal acne or closed comedones. In today's video, I'm going to be sharing 3 treatments that will work on both fungal acne and closed comedones. So let's get into it so you can finally get rid of that texture and those tiny bumps on your forehead or on your face. Now, before we get into the treatment steps, I will say if you are unsure if you have fungal acne or closed comedones, you want to make sure that your skincare routine is fungal acne safe, just in case it is fungal acne. But since you are not sure, let's just make sure all of your products are fungal acne safe. If you don't know what that means, go ahead and watch this video here, which I go through and I show you exactly how to look for products that are fungal acne safe, and I break down exactly what that means. The first treatment is how I personally got rid of my fungal acne. This is the Dela Cruz Sulfur Ointment. If you watched my first how to treat fungal acne video, you know that I rave about this product. Like I said, this is personally what I use to get rid of my fungal acne. But guess what? This also will work on closed comedones.
What is she saying?
If you have closed comedones, you want to apply this to your face at night for about 10 to 15 minutes, just a thin layer. You don't need a lot. Rinse it off and apply the rest of your skincare routine. Sulfur is such a great treatment for both fungal acne and closed comedones because it is an antibacterial and an antifungal. It's an antimicrobial, okay? And it is basically like an exfoliant as well. So it is going to slough off those dead skin cells. That is what's causing that closed comedone or those tiny bumps in texture. And if it's fungal, because it's an antifungal, it's going to treat that fungus and get rid of it too. It basically dries everything up and then washes it away. So if you have texture from closed comedones or if it's texture from fungal acne, sulfur is a good way to treat both of those. The second treatment that will work on both fungal acne and closed comedones is going to be benzoyl peroxide. Benzoyl peroxide is a tried and true acne product. It is heavily researched, and in my last video I told you that benzoyl peroxide is a good treatment for closed comedones, but it does in fact also work on fungal acne.
I said what I said.
My favorite benzoyl peroxide product is the Asepsia Acne Treatment Cream that I get off of Amazon. Now, benzoyl peroxide can be irritating, so whether you're treating closed comedones or fungal acne, you want to apply it to your face in 2 ways. I like to apply my benzoyl peroxide after my moisturizer, as I told you guys in that treatment video. Or you can apply it to your face kind of like a mask and then rinse it off within 10 to 15 minutes depending on the sensitivity of your skin. But yes, benzoyl peroxide will treat both fungal acne and closed comedones. So that is also another treatment option if you are unsure which one you are dealing with. Now, the last treatment that I am going to mention is one that is beneficial for both fungal acne and closed comedones, because unlike sulfur or benzoyl peroxide treats your skin from the outside layers of your skin, this treatment attacks your issues from deeper layers of your skin, making it a safer treatment, especially if you have sensitive skin or if you're a younger person.
Can I get a oh yeah?
You can start using it as young as 12 years old. There's been many comments that I've seen of people saying, you know, they're 14, they're 15. Is this something that they can do? Yes, this treatment is something that you can use too. And that treatment is the different gel, which is basically Adapalene at 0.1% strength. This is the first retinoid that you can purchase over the counter here in the United States. So I personally picked this up at my local Walmart. You can also purchase it off of Amazon or any local drugstore to you. But this is a treatment where you have to be patient with because you have to be in it for the long haul. With Differin, you want to use it for a minimum of 30 days, but really and truly 3, 4, 5, 6 months. The good thing about using the Differin though is that this one tube would last you at least 3 months because you only need a pea-sized amount for your entire face. So I like to apply this to my finger and then dab it all over my skin and then pat it in all over. I recently started to incorporate Differin in my evening skincare routine to see if it would really help me make a long-lasting difference in my fungal acne, and it also treats fine line and wrinkles, hyperpigmentation, and any other texture issue that you may be having. So it's a great all-around treatment. And because it's working from the deepest layers of our skin, it's going to help you get rid of fungal acne, and it's also going to exfoliate away your closed comedones. Studies have shown Adapalene to reduce acne by 60% in all of their participants over the course of 3 months of daily use. If you're going to use Differin, which I think has the potential to have the most long-lasting change in your skin, you have to have patience and you have to be in it for the long haul.
Well, if you stop playing around and do them, then we wouldn't have this problem, would we?
This is not a product where you think you're only going to use it for 2 weeks and then move on to something else. No. In order to see long-lasting change in the overall health of your skin, which includes closed comedones and includes fungal acne, you want to use it as long as possible. Now, if you have sensitive skin, you probably don't want to go in and start using Differin every single night right away. You probably first want to use it maybe once every third night for 2 weeks, and then work up to every other night for 2 weeks, and then finally move on to every night. Because the Adapalene is working from the deepest layers of our skin outwards, it will cause all of the gunk in your skin to come to the surface quickly. So you might go through some purging, meaning that you're going to see maybe an increase of pimples as your skin is getting rid of all of that gunk. So don't be alarmed if around week 2 you start to see your acne get worse. That's how Adapalene works. It's going to get worse first before it gets better. Stick through it, because I promise on the other side of it, you're going to look great. Okay, I am currently on week 3. 1, 2, 3, yep. I am currently on week 3 of using Differin. So I just got to the point where I'm using it every other night. I started off by using it every third night. So I just got to the point where I'm using it every other night, and I am going through some purging right now. But I'm excited because that means that all that gunk that was hiding in there, that was probably going to come out in the next 2 to 3 months, is coming out now, and I'm not going to have to worry about it down the line. So I'm really going to be Flawless Skin Unique. If you want to see my Differin journey, let me know down below in the comments so that I know that that's content that you guys want, and I can make sure I can talk more about my personal journey with Differin and the differences that I see in my skin before and after using it. So if you're still unsure if you have fungal acne or closed comedones, choose one of the 3 treatments that I just told you guys about. Just one. Don't try all of them at one time. Choose one treatment, okay? Don't do too much with your skin. It's going to give you the opposite of what you want. You're going to end up with inflamed skin. That's not what we want, okay? You don't want dry, inflamed skin. That's not it. You want clear skin with no texture. Don't give yourself a different problem, okay? So choose one of the 3 treatments. Let me know how it goes for you guys, and I will see you all in the next one.